Okay, welcome back to part 5. If you're just joining us, we're talking about cancer drugs, MCQs, hormone drugs, MCQs, antimicrobial drugs, MCQs, and cardiovascular drugs, MCQs, just a few. So continuing on, we just talked about itraconazole and how itraconazole is, let's see the answer. It's all mixed together here, but how it is the treatment for invasive aspergillosis. Okay, moving on. Sulfonamides can cause A. Hemolytic anemia, B. Aplastic anemia, C. Stevens-Johnson syndrome, and D. all of the above. And the answer is D. all of the above. So let's talk about sulfonamides. Sulfa drugs are drugs that are derived from sulfonamide, a sulfur-containing chemical. Most sulfonamides are antibiotics, but some are prescribed for treating ulcerative colitis. Sulfonamide antibiotics work by disrupting the production of dihydrofolic acid, a form of folic acid that bacteria and human cells use for producing proteins, e.g. sulfa methoxazole and trimethoprim. Examples of these are Bactrim, Bactrim DS, Mcqs, Septra, Septra DS, Cotrim, and others, Sulfatrim. Do not mix with warfarin. That's the message here with these sulfamides. What is aplastic anemia? Aplastic anemia is a disease in which the bone marrow and the blood stem cells that reside there are damaged. This causes a deficiency in all three blood types: red blood cells, anemia; white blood cells, leukopenia; and platelets, thrombocytopenia. Aplastic refers to inability of the stem cells to generate the mature blood cells. What is hemolytic anemia? It is a form of anemia due to hemolysis of the normal breakdown of red blood cells, either in the blood vessels, intravascular hemolysis, or elsewhere in the human body. It has numerous possible causes ranging from relatively harmless to life-threatening. The general classification of hemolytic anemia is either inherited or acquired. Treatment depends on the cause and the nature of the breakdown. Symptoms of hemolytic anemia are similar to other forms of anemia: fatigue and shortness of breath, but in addition, the breakdown of red blood cells leads to jaundice and increases the risk of particular long-term complications such as gallstones and pulmonary hypertension. What is Stevens-Johnson syndrome? A toxic epidermal necrolysis. There are two forms of a life-threatening skin condition in which cell death causes the epidermis to separate from the dermis. The syndrome is thought to be a hypersensitivity complex that affects the skin and the mucous membranes. The most well-known causes are certain medications, but it can also be due to infections and more rarely cancers. Okay, so there you have it. So I hope you enjoyed this MCQ series. Tune in next time for more MCQs with Dr. Sam. Thanks very much.